Macular degeneration, also known as age-related macular degeneration or AMD, is one of the leading causes of sight loss in the developed world and is a condition which usually affects people in their 50s or 60s. According to the NHS, 600,000 people are affected by AMD in the UK currently, with no standard treatment available to cure it. AMD arises when the macula, a tiny spot in the centre of the retina, becomes damaged. When this happens, the person affected experiences a loss of their central vision. However, their peripheral vision remains intact. This makes everyday tasks difficult and near impossible, such as driving and reading. The retina is responsible for capturing light and sending it to the brain, and by doing so, this enables vision. Upon closer inspection of the retina, you can see that it is made up of several different layers of cells. Photoreceptors detect the light, but a layer of cells that underlie them, called the retinal pigmented epithelium, or RPE, are also important as they support and nourish these photoreceptors and prevent any waste buildup. These cells lose their function and as a result photoreceptors die. When this happens in the macula, AMD develops. AMD can manifest itself in two different forms, a dry form and a wet form. The dry form is the most common and occurs when waste builds up in the macula and photoreceptors die. For the dry form of AMD, there is currently no cure, with a high zinc diet to slow down progression as the only approach that exists. The wet form, which is characteristically more severe, happens due to blood vessels growing and invading the retinal pigmented epithelium and can develop into a total and complete loss of central vision in a matter of weeks. Wet AMD can currently be treated with injections which stops unwanted blood vessel growth and restores vision. However, this method of treatment is not favourable as it only suppresses AMD and the patient must keep receiving these injections for the rest of their life. Therefore, the sight loss that is inflicted from most cases of AMD is irreversible. Stem cell therapies offer exciting potential in curing AMD. Current research in this area is trying to find a way to produce functioning RPE or photoreceptors from stem cells successfully, and safely transplant these in the eyes to replace those that are damaged or lost in AMD. Recently, a clinical trial conducted by the London Project to Cure Blindness has reported successful transplantation of RPE cells derived from human embryonic stem cells in 2 patients with wet AMD. What these researchers did was grow embryonic stem cells and turn them into RPE cells. Then, by seeding a single layer of RPE cells on top of a polyester membrane, they created a patch to be transplanted into the macula of the patients. The patch was shown to be successful in transplantation as it remained intact in both patients after a year with no adverse side effects. As well as this, both patients experienced a dramatic recovery and improvement in their vision. A BCVA score is the number of letters that can be read on a letter chart with the glasses prescription. Patient 1 went from a BCVA score of 8 to 29 letters, whilst the second patient's score was improved from 10 to 39 letters. On top of this, patient 1's reading speed increased from 0 to 48 words per minute. The second patient's reading speed increased from 2 to 83 words per minute. Not only does this trial confirm the safety and feasibility of this technique to potentially treat AMD, but also is the first study to show amazing sight improvement is possible with stem cell therapies. This trial at the London Project to Cure Blindness is among the first of its kind to be conducted. Around the world, many other researchers are trying to do the same thing. This could mean that a cure is on the horizon, and the hope is that we've already found it for both wet and dry forms of this disease. Much still remains to be done before stem cell therapies for AMD can become a standard procedure offered by the NHS. But with continued research, we are on the way to finding a cure to one of the leading causes of sight loss in the UK.